I've had 5 cosmetic procedures, some done when I was way younger, and I'm not afraid to admit that I didn't ask enough questions. I made impulsive decisions on the cost, the ease of location, and I thought I asked enough questions, but I didn't know what I didn't know. And back then, all the online resources that we have now didn't exist. So looking back, a few simple questions would have saved me stress, money, and a lot of disappointment. So today, I'm giving you 10 simple questions that I wish I knew before I ever stepped into a consultation with a plastic surgeon. This isn't going to be a full comprehensive list of basic questions that you can find on Google. Instead, these are questions that reveal how they operate, how honest they are, and whether they are actually the right surgeon for you. And trust me, the answers matter more than you think. I've broken these questions down into categories. Questions about the surgeon's abilities, questions about the procedure and recovery, and then questions about expectations. Again, this is not a full comprehensive list of questions to ask. If that's something you want, let me know in the comments and I can certainly make a video. First question, how many times have you performed this procedure? Now, I love this question because it cuts through the fluff. Instead of asking, what are your qualifications or experience, which always leads to a rehearsed answer, this gets straight to the real world experience. Plus, you can find this information on their website. And it's something I would recommend already checking when researching their site. If you're already in the next phase of research, you're not just simply checking out the surgeon. You're going a bit deeper to qualify if they are right for you. When I first started getting consultations in my early 20s, I assumed any cosmetic surgeon could do anything. And that's not true. Some do a procedure 3 times a week, and some may do it 3 times a year. Now, a lot of surgeons specialize in a few procedures, and they've become known for their facelift technique or their liposuction method. And you may want to work with a surgeon that has a specialty. And if they don't, that's fine. That's okay too. There's a lot of surgeons who do many procedures on the body. So just ask them how many times have they done that or how often they perform that surgery. Number 2, can I see more before and after photos? Yes, you can find before and after photos on their website or their social media, but as someone who has looked at hundreds of online galleries, they often don't contain a lot of images of one procedure that you are interested in. Their social media might have a lot of before and afters, but if not, it's a good idea to look for more patterns, to see how similar those before and afters are. Some people want a really natural look, and others want more dramatic results. Some surgeons are more conservative than others, but looking at a series of before and after photos for the procedure you desire will give you an idea of what kind of results that they can deliver. And I used to feel awkward asking for more examples, but you really shouldn't. A good surgeon will happily show you, and don't forget to ask what the timeline is in the photos. With some procedures, you may see results right away, and others take 6 months to a year to fully heal and see the full effect. So you should be asking how long between the before and after, like at what stage in the healing process that they are. Number 3, would you perform this procedure on a loved one? This one always gets a reaction. It's not about being dramatic, it's about understanding their confidence and getting a sense of their personality and vibe. We're not looking at specifics of like maybe how their mother wouldn't be a good candidate for a certain surgery, but we're more looking for their reaction and how they handle that question. If they hesitate or give like a really vague answer, just trust your gut. Every great surgeon I've spoken to answers this immediately and clearly. Number 4, what are the most common complications and how do you prevent them? Now, this is a question that will tell you 2 things. 1, are they transparent? And 2, do they have systems in place to protect you? Every surgery has risks, and a good surgeon will be transparent about that. But we also want to know what could go wrong and what has gone wrong in the past. And even if nothing has gone wrong in the past for that specific surgery and surgeon, you want to ask what known complications are in the industry to get an idea of their transparency and honesty. Number 5, what should I expect on surgery day? You'd be surprised how many people go in without understanding the logistics, and there's a lot of them. Every surgeon has different procedures. Some require blood work before a procedure and some don't. Many details will also depend on what procedure you're inquiring about. But here is where you want to get a good idea of the run of day and expectations. What do you need 2 weeks before your surgery date? 1 week before? The day before? When do you need to stop eating? How long is the procedure? What medications do they give you? There's so many details to consider. So if a surgeon explains this clearly, it usually means their whole process is really organized and that they have a team who knows what they're doing and what procedures are to follow. Hey, if you've made it this far in the video and you've been enjoying this content, I would love it if you hit like and subscribe. It helps me make more videos for you. Number 6. How long until I see final results? I know we all love immediate gratification, but swelling, bruising, numbness, and healing take time. Again, you want to look for transparency and honesty with this question and understand that you need to be patient in the healing process. Ask what's normal at each milestone. Everyone heals differently, and there's things that can impact your healing. But you can ask what typical results look like at 2 weeks, at 6 weeks, 3 months, or 6 months. A good surgeon sets realistic expectations. If you feel like something is off, this is a question that would spark that feeling in your tummy that tells you to listen to your gut. Number 7, what does recovery actually look like, and what kind of support do you provide? This is where hidden costs and hidden responsibilities show up. Different surgeons offer different levels of support. I've had surgery where one will check in once in the recovery process and then never heard from again for follow-ups. And that may be okay with you, or you may want more support. Some procedures require post-op lymphatic massages, the aid of a nurse, someone to cook for you, help you get around, use the bathroom, help you ice, help you get comfortable. I personally want to know when the surgeon will be checking in after the surgery, while in recovery, and down the road to see how I'm healing, because I've had procedures where I felt like a number, and it was like being at a restaurant with a time limit and how long you can sit at the table before they want to flip it and get the next customer in. It's just not a good feeling. So determine what support you will need, what support you want, and if that's included in the fees or not, and what the whole follow-up process is like. Number 8, how long will my results last? This is one of the most important questions I didn't ask. I was young and naive to think that just because I spent all this money on surgery that it would be permanent and forever. But then as I got older, I realized there's this thing called gravity and aging. When you ask this question, again, look for transparency and honesty. Do you feel like the surgeon is over-delivering on a promise? Many responses are going to depend on your age, how you heal, and know that many procedures may require touch-ups in a few years or a decade, or maintenance appointments that may be required for longer lasting results. You may want to reconsider the procedure if you find out that more surgery is expected down the road to keep getting the desired results. I considered some surgeries and then decided it wasn't worth it for me in the long run. Number 9, what can I realistically expect? Expectations and communication are so key in a successful surgery. And this is where I feel like a lot of people who are unhappy with the results make a mistake. I hear from a lot of people who are not satisfied with how they look after surgery or how their scars look. And that causes a lot of disappointment, anger, frustration, and stress. Whether it's your own fault or the surgeon's, it's really a two-way street here. You need to ask what you can realistically expect from the surgeon and also understand what may or may not be achievable for you. You may have to accept that your nose may never look exactly like a supermodel that you admire. Your scars may not be perfect, or they're going to require other treatments to help them fade. Or due to your anatomy that you can't get the shape of someone else, you can't get that jawline or of that supermodel that you see on social media. A good surgeon will tell you what's possible, what's not, and where your expectations might be too high. It's okay to have inspiration, but really consider what's realistic for you and what do you want out of the procedure. What result are you looking for that would make you happy, and what result would make you unhappy? I firmly believe that there's no perfect outcome. There may always be something that's not 100% perfect like you wanted. The surgeon can't tell 100% of the time how your body is going to react or heal. So understanding that before you go under the knife will help. And if they promise perfection, run. And this leads right into question 10. Number 10, do you offer revisions and what do they cost? If you are unhappy with your results, does that surgeon offer revisions? I'm gonna be super honest here. I have never had a procedure without a revision. It's incredibly common because, again, 100% perfection is not possible. The doctor doesn't know how you will heal. There's normal and typical results, but that may not be the case for you. So ask what the revision process looks like. Ask if revisions are even possible and at what timeline. Over 10 years ago, I did a revision on liposuction around my stomach area, about 3 months after. And another time I did a revision at 1 year after. So ask how soon they'd revise if something doesn't heal correctly, and if there's extra costs. Sometimes there is, and sometimes there's not. It really depends on the surgeon and the hospital, because sometimes in a hospital setting, you do have to pay extra fees to an anesthesiologist. And if the surgeon tells you, you won't need a revision, that's another red flag. These questions aren't about being difficult. They're about being informed, thorough, and determining if the surgeon is the right one for you. A great surgeon will appreciate that you care about your health and your outcomes. And speaking from experience, the quality of your questions directly affects the quality of your results. If you found this video helpful, let me know in the comments. I'd love to share more of my personal experiences and the things I wish I knew sooner. And if you're preparing for a consultation and you have more questions, let me know in the comments. I'm wishing you the best of luck, so take care of yourself and we'll see you in the next one.